Thanks, everyone, and welcome back. Our next task is to be divided into breakout rooms where we have a chance to reflect on the wonderful things we heard about from our keynote speaker and also from our wonderful panel members. And the goal from our breakout room is to give everyone chance to speak about how the things they heard about relate to their work, share their experience and how that relates to them. We value everyone's voice and input, but we especially want our community partners and members to, share their thoughts with us and really speak about their work. Each group will work together to determine what work need to be done in terms of income and employment to help move forward in terms of health and health equity. And then all the discussion points and action items will be shared with the group all together at the end. For each breakout room, we have a facilitator and also we have a note taker to help with bringing those points back to the whole group and also to take them with us beyond the summit today and, for the next steps. Any questions or concerns before we go into the breakout rooms? Okay, thank you so much. So I think we are ready. So let's go ahead and start to give us enough time to, share ideas.
So we're just going to go through each room and have each facilitator just kind of recap what you all talked about. The first room, I think, was Carrie, was the facilitator. So Carrie, if you want to share.
Yeah, thanks. I'm going to share in partnership with Brandon, who is in our room as well. So he and I. So I am going to talk a few things about like our next step and action items, if that's okay. So we talked a lot about the importance of translating the work we're doing into like real life applications. So if we have community partners, like how do we help people translate even the work we do with our community partners so that the research experiences translate to a value in a resume, right? And so that's a very important thing that we talked about. One of the people in our group talked about her experience with career mapping, and that can happen at any stage in life, whether you're 18 and just starting out, and tying back to what we heard yesterday, even the micro-credentialing as a starting point if people feel like too overwhelmed by the college or the institution or jumping into that, but just helping people translate or start somewhere and then think about a path and mapping it out and how do we get there and just thinking very intentionally about that. And then I loved that Arthur made the note that, we create all this data and all this evidence and how can we come together to use that data, leverage that information to magnetize money is the phrase that he used. And I thought, oh, I love the idea of magnetizing something. So that was just a great point we talked about a little bit. And that really people have the agency to lead change in their own communities. And as a researcher, I think a lot about that, like what I have to offer and contribute to people who have what they need to make change in their own communities. And entrepreneurship also as a path for people to have agency in their own decision and lives. And so, yeah, Brandon, you want to add anything to that? I have lots of notes and they're kind of sloppy.
I think the last action item that I just would like to highlight was that we spoke about how to create more jobs in the university and not necessarily needing the academic credentials, and the lived experience could be more be leveraged as an option instead.
I think that's the most important thing we talked about. Thank you, Brandon. We'll stop there, Alex.
All right, thank you. Group one. Group two was Maha's group. Maha.
Thank you so much. We had a great discussion, and I have Danielle back me up if I forget anything. but we had a great exchange of, thoughts about, how wonderful, the opportunity to learn about what work is being done out there. Couple of our members expressed their, uh, interest and learning about mothers and justice program in particular, and how that helped and contributed to underserved community, and they were very excited to know about that. We also talked about community engaged research and how important for the work under that umbrella, including research, is to listen actually to community members. And Dr. Butler in our group, shared a great point regarding listening to individuals and, really learn about the community needs and then move forward on that. We also talked about transparency with the community and then return back with results and also with action items to address what we find, and really have more sustainable relationship with the community. Other things brought up is to, mistrust, and, the work need to be done to eliminate mistrust and really build a more trust relationship with research, with healthcare providers, and the vital roles, faith-based organization can play with that. And we all listened to great examples throughout, the summit, how this can be really a tool for community engaged research. Reaching out to the community members where they are, and really be active listener. I think that's a big thing in our discussion. Did I miss anything, Danielle, my group?
No, you covered it. Yes.
Okay, thank you so much.
All right, and then our last group was, I believe, Rick's group.
Yes, thank you. We had a wonderful conversation talking about a variety of important issues, and a very passionate group felt strongly about a variety of issues. So, and thanks to the team of note takers. Please, anybody, let me know if you feel like I'm leaving anything out. One of our colleagues who works with a community organization wanted to make sure that as we move forward, we think about whether perhaps the folks most involved in our organization are a relatively middle to higher income or education group, and if so, to think about ways that we can and should be doing outreach to more disadvantaged members of our communities. So to be sure, especially if our organization, when we think about it or look at it, or maybe look at some data about our members, realize that they're relatively okay economically, or have a significant amount of education. Remember, that's not true of lots of people in our communities, and we need to figure out how to reach out to those who are more disadvantaged and have less education or income. And related to that, learning how to go into the community, starting on the inside rather than coming in from the outside. Another suggestion that I think, we didn't have time to vote or each chime in, but my sense was there was a lot of consensus supporting this idea, and that is the broad implementation of and adapting the RX Kids model, the direct cash supplement model, in a variety of ways and in a variety of communities, a variety of disadvantaged communities, including perhaps transgender community, but got one special mention, but that model be adapted and replicated in various communities, but also in different different populations. Obviously, moms are an important one, but there are almost certainly lots of other needy subgroups that the model might be adapted to as well. And another point of emphasis that the group felt strongly about was just as RX Kids is doing, giving the folks who are receiving the money the decision-making power about how to spend it, rather than what some other programs, a variety of programs, social need and quote unquote welfare programs do, that, you know, make decisions for the recipients about what they're allowed to spend money on. Soda was one example for a nutritional assistance income, I presume, that, you know, the decisions made, you cannot buy these kinds of groceries or these other kinds of groceries. So the group has strong feelings that adults should be treated with autonomy and given the power to make those decisions about how to spend the funds. The last point that again, I think the group would significantly agree on, though we didn't poll them, was that the kinds of decisions about how public funds, especially, are spent, are going to be affected, and I quote, by who's in the room. So folks should perhaps think a little bit more differently than some folks are talking about in the news anyway, about, oh, my vote doesn't matter, with the reminder that your vote ultimately determines who the folks are who are making some of these decisions about how money is spent, whether people are given autonomy to spend it, and what the priorities are. So to be thoughtful and remember that who's in the room, and especially if they're elected folks, that we have decisions to make that can make a difference. Anything important that I missed, group? Okay, thanks again for a great discussion.
These are really wonderful points and action items, and I really want to open the floor, since we have a little bit time, for everyone to chime in right here and let us know your thoughts about the points raised by the groups, and even if you want to follow up on the presentation and panel discussion and speak about that in terms of your own experience, please feel free to share that with the group now.
Dr. Abdur, my apologies. I actually forgot to mention the point that I made in the group about transportation. I think that for the working poor, having a car can be as important as having somewhere to live, in terms of your ability to reliably get to work and keep your job. And we had a little conversation about all the forces that have led to the lack of a train system in the Metro Detroit area, including the influence of the car manufacturers, but also apparently the influence over the decades of suburban communities voting against regional transit. And so the importance of trying to really make a difference on those issues, so that folks with less income would have greater transportation options, where they can spend less of an entire day getting to appointments, getting to work in the community. So just wanted to add that.
Thank you so much for raising that point. And I think it's relevant to City of Detroit community members, and the struggle with transportation, especially with long winter. So this point is valid. I just want to reflect on one thing that we might, we learned today, is the the full scope of how income really influence health. It's not just the income itself and how it will drive your health insurance, but there's so many other things around that: transportation, being connected with resources, really focus on your health or think about your health, at least when you have so many other demands going on. So one thing I really appreciate about today's discussions, touching on all the different aspects income and employment can really influence individuals' health, especially in underserved communities. Anyone else want to share?
I just wanted to provide some context. I put a link in the chat just to kind of let people know, a lot of the income supplement or the cash supplement research we heard about today focuses on moms and babies and young families. But last year or so, the National Cancer Institute actually funded several centers to address persistent poverty and cancer prevention and control. So I was sharing a link about one of those that's out in California, where they're looking at the impact of universal basic income on colorectal cancer screening, and as well as the earned income tax credit. So just kind of opening up just the possibilities here, the kind of work that's being done when it comes to thinking about income and wealth and health outcomes.
Thank you so much for sharing.
May I chime in? For those who weren't in our group, I am the Director of Community Outreach and Engagement for Code of Community Action Alliance on the far west side of Detroit. We have been really thinking and racking our brains about access to transportation, to healthy food. We are a food desert, and we're trying to work on that. And also to health care. It appears that once a person settles in a neighborhood, they don't like to cross boundaries, large boundaries, such as Greenfield, Ford Road to the south, 96 to the north, and Rouge Park to the west. Those are our boundaries. And they tend to ask us in our intake office, the first thing they would ask us, do I have to leave the neighborhood? They don't want to leave their neighborhood. They feel safer if there were services within a quick ride, a short bus ride, a lift. And we've tried to supply lift rides for health and some social services. So to hit on transportation, it is a vital part of it. Although on the other hand, we're trying to establish walking clubs. So we want people to have access to health, but at the same time, we want to say, you could walk those 6 blocks and kill 2 birds with 1 stone. So this work is delicate and meeting the needs of a variety of people with a variety of needs. The caregivers can't leave the house because no one's to care for the patient or their loved ones. The grandparents raising grandchildren, the grandchildren don't have a problem walking, but if you have arthritis, you can't do the 10 blocks. We no longer have as many neighborhood schools. My kids go to a school that has a health clinic in the school, and that's why I'm able to work the hours that I do work without having to worry about my asthmatic daughter, who is my granddaughter I'm raising, who also has nosebleeds and a weak knee. So I don't have to worry about that because she has access. But then I cross 8 Mile and I come into Detroit, and there's the lack of neighborhood. Let me put it this way: neighborhood access, because it seems that our health systems are centrally located. You're all near each other, but where's the community surrounding it? And how can you help us become healthier without access? And access includes transportation, and it's not just financial, it's logistics. And that's the problem we face every day in this neighborhood.
Hi, I'd like to borrow from a lot of what I've heard. The work is delicate. I think I really will take that away with me. A lot of this is around policy, both from the governmental level and what we're doing in our city. I was fortunate to be around at the time when Kroger was buying all the Farmer Jack stores in Detroit, meaning Michigan. And in the city of Detroit, we had a beautiful Farmer Jack right off of Jefferson at Shippard. That store was the only one that they did not buy, that Kroger did not buy. So when we talk about food deserts, you know, none of this comes about willy-nilly. It's all planned in terms of growing up in a city that has an oligopoly on you know, the type of manufacturing that we do, where we live, how we get to our work, how we get to our places of worship, where we live, redlining, etc. So I think that a lot of this work has to be taken at the policy level, as well as, of course, homegrown. I like the idea of starting from within or reflecting from within. That is what I think community-based research brings over other academic types of research. Thank you.
Thank you so much for sharing. We appreciate all the great points being raised. Anyone else wanna go ahead and participate with the discussion?
Okay, I just have to add, we did talk a little bit about the role of digital exclusion and what that means for people, not only being able to like participate in research or learn about the opportunities we shared today, or community health workers, but looking for job opportunities, and then you need to be able to access to apply for those jobs, because you can't carry on a resume anymore. I mean, that's what I did when I was young, is actually like physically drop a hard copy off. We just talked about people being able to turn in papers in classes. Is that an option anymore? The idea that like being able to communicate via paper or face-to-face is just no longer part of the reality of being in the workforce, and living in a city like Detroit that has, you know, low internet connectivity rates, just adds another challenge to be able to get involved with those opportunities.
That's a great point. I think that's really connect to the like multiple aspects and you know, income, employment, where you live really drive everything around. So you know, that's a great point. How you know access to internet now is a necessity, and is it available for everyone? So I appreciate this point. Okay, anyone else? We have a couple of minutes.
I just want to give a great compliment to you, Maha, and also, you know, everyone that had anything, Benji, everyone that organized this. This was great. I've heard from a couple of community members who said they're proud, they're happy to be here. They're glad they came. They're glad that they came. And then one person did say that, you know, these type of settings, we need to take advantage of them, meaning, you know, Zoom and meeting each other electronically like this. And I know that some people probably wouldn't have been able to come, like myself, if this were in person because of circumstances. But let's take advantage of this. Let's continue to engage. And also, and I know that's what we're planning on doing anyway, but I'm just encouraging it, handing you your flowers. You and Maha, you and Benji did a great job. I just wanted to say that. And also, continue the good work, because people are getting things out of this, and a lot of folks have learned a lot of things, and including myself. So thank you.
Thank you so much, Rhonda. I want to shout out to the committee that really supported me throughout the year. You know, the summit committee really meticulously work in having the best out of the summit. So I appreciate their work. Nothing will happen, you know, without the group effort we put together. And thank you so much for acknowledging that. I want to thank everyone for being here and, you know, remaining connected to the end of the summit. We really appreciate everything you shared with us today, and hopefully we'll take all the feedback with us to move forward, to build on. That's the goal. And we definitely plan to stay connected and not lose that great connection we have today, and also in the previous summits.